all over the world, anywhere where you watch us from top of the moment to you. My name is Chief Ololodo, and I don't come here to make sure we're giving her nothing but the best on top health matter. And to do this with us is no other person but Dr. Barth. I'm the CEO, MD, Grace Valley Medical Center. Good morning, sir.
Thank you, Chief.
Well done, sir.
Yeah, thank you very much. I'm happy to be back today.
Yeah, you're welcome.
Yeah, thank you very much. Good morning, viewers at home and around the world. Today, we'll be looking at a new topic. We'll be looking at diabetes and COVID-19. Diabetes and COVID-19. What is it all about? Okay? And I want to say a big thank you to the interventional cardiologist who was with us 2 weeks ago, just in case he's watching. Okay? Now, we'll be looking at diabetes and COVID-19. But first of all, I want to give an overview of what diabetes is all about. I'm sure diabetes is a word so many of us have heard. Sometimes we'll call it diabetes mellitus, or DM for short. They both mean the same thing. Okay? Now, I will simplify the definition in such a way that everybody can appreciate the problem, okay, that this disease has created to mankind. At the moment, 422 million people globally are living with diabetes. Sometime in 1980, it was only 108 million people that had diabetes at that time. But over the last decades, the numbers have quadrupled over time. Let me start with these statistics that is somehow frightening. Every 5 seconds, one person develops diabetes. Every 10 seconds, one person dies from diabetes. And every 30 seconds, a limb is lost to diabetes, meaning that someone's leg, lower limbs, may be amputated as a result of the complications that could arise from uncontrolled diabetes. Now, what is this diabetes? Diabetes is a chronic disease that is characterized either by the body's inability to produce insulin or the body's ineffectual use of the insulin that has been produced by the body. The organ of the body that is responsible for the production of insulin is called the pancreas. And the insulin is produced in the islet of Langerhans in the pancreas. This insulin is responsible to ensure that the body is able to use the glucose that we derive from the food that we eat in giving us the energy that we use to move about, to talk, and to do a lot of things. Now, some of us who did biology in secondary school can remember the major classes of foods. When you eat carbohydrate, the carbohydrate is a macro molecule that gets broken down into a smaller component that the body is able to make use of. So when you eat carbohydrate, the body breaks it down to what we refer to as end product of carbohydrate digestion. In this case, it is called glucose. And that glucose is what the body makes use of in producing the energy with which we move about, talk, and do, and carry out our daily activities. If you eat a protein-containing food, for instance, egg, milk, or meat, it gets broken down to the smallest part, molecule, that the body can make use of, and that is called amino acids. In the same way, if you eat foods that contain fats and oil, it gets broken down to the smallest molecule that the body can make use of, which is called lipids. Okay? Now, this gives us an idea. Now, diabetes is, in a way that everybody can appreciate, can be likened to a disease that one can typically describe as suffering in the midst of plenty. You have plenty of blood glucose in your system, and yet your body cells, your body systems are unable to make use of them. What causes it? That takes us to the types of diabetes. Majorly, there's diabetes type 1, type 2, and gestational diabetes. The other classification that include other types, but we'll limit ourselves to these 3 major ones. Now, let's go to type 2 diabetes. What is type 2 diabetes? What causes type 2 diabetes? Type 2 diabetes is brought about by the body's ineffectual use of the insulin that has been produced by the body. The system's ineffectual use of the insulin that has been produced by the body is what gives rise to type 2. What happens when the body cannot make good use of the insulin that has been produced by the pancreas? The sugar level that we derive from the carbohydrate that we have eaten that gets broken down to glucose begin to rise gradually over time in our bloodstream. And of course, the normal fasting blood sugar that everybody should have is between 60 to 100 milligrams per DL. That's when you have not taken any breakfast, when you have not had anything in the morning. But when you have eaten food, we refer to that as random blood sugar. The level should be between 60 milligrams per DL to 180 milligrams per DL. That's for random blood sugar when you have had a meal. Anything above this signifies some degree of derangement. So what happens is that when somebody has challenges with diabetes, the blood sugar level begins to rise in the blood because the body is unable to utilize the insulin. The body is already is unable to utilize the glucose that the insulin that the pancreas has produced in the body, so the sugar level begins to rise. And in type 1, thank you very much. In type 1, it is a different ball game. The body is unable to produce insulin in enough quantity in some cases. And that is why people who have type 1 diabetes usually will have to depend on insulin. Back in the days, type 1 diabetes was described as insulin-dependent diabetes or juvenile or child-onset diabetes, because anybody who has type 1 diabetes will usually have to depend on insulin for life, for the rest of the person's life. But not so for type 2 diabetes, which previously was described as adult onset or non-insulin dependent diabetes. And of course, anybody that has this type 2 diabetes, in some cases, the person may not even get to know that he or she has it. He may present with little or no symptoms. So the narrative is that people get to find out over time, maybe many years after the diabetes has started in them, that they actually have diabetes. And at that time, it may have caused organ damage. Usually, the organs that are worst affected when you talk about damage coming from diabetes are usually the heart, the blood vessels, the kidneys, and of course, the nerves and the eyes. And diabetes is responsible for nearly 3% of blindness in the world. Earlier in the week, the world celebrated or observed the World Sight Day. Okay, so diabetes is responsible for nearly 3% of blindness that we have in the world today. But this morning, we are looking at diabetes in relation to COVID-19. It is already a common knowledge that anybody who have anybody that has an underlying illness will have a worse outcome, may have a worse outcome or a bad outcome if the person ends up picking COVID-19. Diabetes is one of those underlying illnesses that can increase one's chance of having a bad outcome when infected with COVID-19, up to 2 to 3 folds. Just last week, the news media was awash with a breaking news that it has been reported that COVID-19 actually has a connection to diabetes. A lot of people rising number of people that picked up COVID who were previously not diabetic were found to have developed diabetes in the course of COVID-19 and shortly even after getting treated or after recovering from COVID-19. A lot of postulations were made as to what could be responsible. Some authorities, some experts believe that the beta cells that are found in the pancreas, a region called islet of Langerhans, are being destroyed or are being made to self-destruct. In other words, it incapacitates the pancreas' ability to produce the hormone that regulates the blood sugar in the body, which is the insulin. That's one way. The second one is that the cytokine storm that is common or that is associated with severe COVID-19 infection may have produced some degree of inflammation that may be causing more cells in the body to be a lot more resistant to the effect of insulin. But these are still being still a subject of research at the moment. Okay, so anybody who has diabetes should know or should keep in mind that this is a time you must ensure that you have adequate blood sugar control, and as well as ensuring that you do not pick up other baggages along the line. And of course, this brings me to the next subtopic, which is risk factors for diabetes. I want to approach this in two ways. There are what we refer to as modifiable risk factors and non-modifiable risk factors. The modifiable risk factors are the ones you have a say, the ones that you can change, okay? The non-modifiable risk factors are the ones that you do not have a say as an individual. You do not have the capacity to change anything about that. And of course, that includes, number one, your age. Nobody can change his or her age. No matter how young you want to make yourself, by changing a whole lot of things about your looks, you cannot change that numbers that make up your age. You can't change the fact that you're black. So race is a risk factor for diabetes as well. It comes with increasing age, okay? Shortly before we went on break, I was trying to describe the different major types of diabetes. And we say there are majorly 3 types: type 1 diabetes, type 2 diabetes, and gestational diabetes. There are other forms of classification which we will not bore you with this morning. And we also said that type 1 diabetes are usually found in the younger age group, okay? Previously referred to as insulin dependent. I like that phrase because it gives you an idea of what to expect for anybody who has it, okay? Or juvenile or child onset diabetes, okay? The second type, which is diabetes type 2, is usually the ones that majority of people have. 90% of people who have DM, about 90% of people who have DM have type 2. And this is the one that can occur in an adult, okay? We're talking about modifiable risk factors before we went on the break. I'll come back to that. Now, the major difference between these two types of diabetes has to do with what happens at the level of insulin production. In type 1, the body is almost unable to produce insulin. And that is a serious problem. Insulin is the hormone that regulates blood sugar in the body, okay? Sometimes when I try to explain the work of insulin to my patients, I usually use a story that insulin works like a teacher that probably brandishes a cane to drive the children in a class to do the right thing. Go this way, go the other way, go this way. Okay, so that is how the insulin forces the body cells to take up glucose. And when that happens, the glucose level at the blood will automatically drop. Because when there are issues with either non-production of insulin, in which case it will give rise to type 1 diabetes. The sugar level will climb up over days, over time. But if the person begins to take insulin, insulin will drive the sugar into cells of the body where they are made use of to produce the energy with which we can move and talk and do a whole lot of other activities. Okay? The phone lines are also open. They are scrolling on the footnotes, so you can give us a call if you have contributions to make in the program. Now, for type 2 diabetes, there is production of insulin, but the body systems are unable to make good use of it. Okay, so the usage can be said to be partial. Okay, and that is why someone may have it, and over time you may not even have an idea that you have developed diabetes. It may just be an accidental finding when you probably go to clinic, and that is why people have it, and oftentimes it does a lot of damage to our organs, particularly the blood vessels, okay, as well as kidney. Don't forget, diabetes is one of the leading causes of CKD, chronic kidney disease, globally. Uncontrolled diabetes and uncontrolled hypertension are the two leading causes of CKD, chronic kidney disease, on a global level. Okay, so coming back to the modifiable risk factors, the ones that we have a say. Okay, I've talked about a little bit of the non-modifiable risk factors. Mrs. Blessing.
Let's take Miss Blessing from Enugu. Miss Blessing, good morning.
Good morning.
You have to turn down the volume on your TV set so that we enjoy ourselves. Reduce the volume, then go ahead with your question.
Reduce the volume.
Thank you,
very much.
Go ahead with your question. Doctor is here.
Okay, I wanted to ask, the diabetes in old age. My mother-in-law doesn't have diabetes during her youthful age, and when she's married, is this old age that she now has it, and she has been on drugs. What could she do to reduce it, to stop the diabetes?
Thank you very much, ma. Thank you very much, ma. Obviously, she has type 2 diabetes, which we refer to as adult onset diabetes. What can she do so as to stop the drug or cure the diabetes? Unfortunately, diabetes is not curable, but it is preventable, but it is not curable. And that is why it is regarded as a chronic illness. It stays with whoever has it for the rest of the person's life. Okay? Now, what she needs to do, I'm happy she's already doing, because we said she has been on drugs. Anybody who has diabetes should ensure that he or she takes the prescription or the medications from his or her doctors. Okay? When we get to treatment, you will hear the other forms of treatment. It's not in all cases that people who have diabetes will be placed on drug. There are non-pharmaceutical interventions, in which case the person can make do with just exercise and lifestyle modifications may suffice to control such a person's blood sugar. Okay? But in some other cases, when these measures are not giving the desired result, such individuals may be started on drugs by their doctors. In some cases too, they may be given insulin injection. We've been talking about insulin produced by the body. We also do know that science has produced a synthetic analog of what is found in the body, artificial insulin, which can be given in form of injection, and it produces the same result, just like the one that the body produces on its own. Okay? So the non-modifiable risk factors, we have said the fact that some of these things are hereditary. It goes from what it can actually be gotten from the children can get it from their parents. Yes, it comes with increasing age. This you don't have a say. Now let's go to the ones we have a say, which are the modifiable risk factor. Which are the modifiable risk factors? Number one, diet. You need to make the right choices when it comes to diet. You need to avoid carbohydrate-containing foods or reduce it as much as possible. You need to avoid saturated fats. Your food should have plenty of fruits and vegetables, legumes, grains. These are healthy diets. Diets that are rich in high fiber are healthy for you, not like the Western diet that we're all used to.
Okay, let's take Etinosa from Edo. Etinosa, good morning.
Good morning.
How are you doing?
Good morning.
Good morning.
I'm fine.
Okay, the doctor is here, Etinosa.
Yes. Is this... Good morning.
Yeah, good morning. We are
I
pleased
just
to have you.
I'm fine. The thing I want to ask, like this hypertension that is talking about, what will someone do to prevent it? Because
Thank you very much.
I,
You see, your volume is loud, and when your volume dey loud, we know if you enjoy the conversation. So you need to reduce your volume first, then you ask your question.
like, because me, when I,
Okay, Tinosa, we have to take you out because you.
Yeah,
you
she has
have
made
to-
her point. What can someone do to prevent? Her question is on prevention. Okay. Now, what you can do to prevent, because I also said that diabetes type 2 is preventable. What you can do to prevent diabetes, there are a number of them. Number one is that you must avoid sedentary lifestyle. Okay. You must stay physically active. You need to stay physically active. Sedentary lifestyle is in a situation where you rarely do any form of exercise, and this is more with the top class, with the elites in the society that are chauffeur-driven to their offices and their homes, and they sit in executive chair and occasionally roll towards
time
one
to
side
time.
or the other, and have little or no time for any form of
exercise.
or increased physical activity. That will not help your cause. Okay, we need to stay physically active. In doing so, it will enable us to maintain a good weight. It will enable us to shed weight if we're already obese and reduce our weight. These are some of the modifiable risk factors that can predispose one to developing diabetes along the line in somebody who previously did not have it. Okay, and you need to also pay attention to your diet. We've talked about that. You need to get enough sleep. Okay, you need to rest. At least 6 to 8 hours of sleep will be enough. You need to avoid stress or learn ways of managing stress, okay, in our environment. These are some of the things that can predispose one to having diabetes. Tobacco use and harmful use of alcohol too are some of the other risk factors that can predispose one to having diabetes.
When you say tobacco, is coffee included, sir?
No, I don't think coffee is a form of tobacco. When we say tobacco use, because when you talk about smoking, you're just talking about a particular aspect. But tobacco use, a good number of people take it as snuffs. So it's not only the people that smoke do the smoking one. And also, in some situations, you may not even smoke, okay? But you can be sitting around somebody that smokes.
Passive smoker.
Okay, so that on its own is equally as dangerous as the person who smokes. Okay, so being a passive smoker, or there's another name they call it. I will remember shortly. Okay, so those are some of the other things that you need to. Okay.
Let's take Alice from Benue. Alice, good morning.
attention.
Good morning, Alice.
Morning.
How you do?
I'm fine.
Oh yeah, chook mouth to ask your question, Dr. Dey here.
Good morning.
So I want to ask a question pertaining to diabetes type 2.
Yes, go ahead.
Yes, it said that sometimes when you are living with it, you don't know that you are diabetic.
Yes.
Is there no signs and symptoms so that we may know if you are living with it?
Thank you very much. Thank you very much. Now, she asked a very key question here. Okay.
Thank you, Alice.
Yeah, for type 2 diabetes, the symptoms are usually less marked, okay, than type 1 diabetes. For type 1 diabetes, that's where you have frequent urination, polyuria. You have frequent thirst. You have challenges with thirst. You always want to drink water. You discover that you're urinating for increased number of times than you used to, okay? You wake up at night many times to go and urinate, nocturia. That is not to say there is only diabetes that can give you this picture.
Let's take Godwin. Good morning, Godwin.
Yeah, good morning, sir.
Yeah, you're welcome to the show, and the doctor is here. Go ahead with your question.
Yes, sir. I want to know about the diabetes symptoms.
Diabetes what, please?
Symptoms.
Symptoms.
Yeah,
Okay.
thank you very much. We are still on it. The same question that the last caller,
Alice asked.
Yeah, Alice asked. Okay, so we are dwelling on the symptoms now. And I said that the symptoms are usually less marked in type 2 diabetes, but they are almost the same. In type 1 diabetes, anybody who have diabetes will have increased urination.
Polyuria.
Okay? Thank you very much. The person may have to go to void urine several times. If such a person is traveling and is on the road, he will have to stop severally before he probably gets to his or her destination to go and void urine, to go and urinate.
Okay, let me pause you a bit, doctor. I'm sorry. Where somebody urinates and ants, because we've heard this, and ant covers the urine, is this a symptom or that's another health issue on its own?
Thank you very much. This question you asked will take me to the stories where a story that we were told that our forefathers used to do.
Okay.
To identify who among them has diabetes and who does not have. We'll still come to the symptoms. Now, in the olden days, we were told that our forefathers, we have another caller.
Okay, Ben, good
from
morning.
Abuja.
Morning, sir.
Yeah, good morning, Ben. The doctor is physically and strengthfully here to answer your question. So please go ahead with your question.
Definitely, it's even happening to my daughter.
Wow.
Right now.
What age, please?
She's 23.
Wow.
But she's still on drugs.
Okay.
I'm only trying all my best to just at least do something for her to get herself.
She's on drugs, not injections.
No.
Okay, thank you very much. Thank you very much.
Okay, just listen and the doctor will enlighten us more.
So that is what we have seen over the years.
Could that be child onset diabetes, sir?
No, this type 2. Adeyinka from Abuja. Good morning.
Adeyinka, good morning. The doctor is here.
Yeah, good morning.
Thank you very
Yes,
much.
Adeyinka, go ahead with your
My
question.
name is Rotarian Abulude from Abuja.
Okay.
Thank you very much, sir. My Rotarian brother.
Yes,
Thank you very much.
Yes, I want to ask, what type of exercise is good for somebody who have diabetes 1?
Okay.
Thank you very
Thank
much.
you very much, sir. The question is noted.
Any other one?
Yeah, that's the only one.
Okay, thank you very much. Okay, so let me tackle his own so that we can go to the 23-year-old lady with diabetes and then we'll back to symptoms so that we can coordinate. Now,
And
types
to the
of
story you were telling us
yes,
for the
to
forefathers.
the stories of our forefathers.
Okay.
Okay, so types of exercise.
Exercise.
Brisk walking. Brisk walking is good enough for anybody.
What does it mean to brisk walk?
The walk that you increase your pace, but you're not running. Okay, you're waving your hand and moving at a faster pace, but you're not walking. You're not running per se. Dancing is good enough. Okay, swimming. Joseph from Abuja. Good morning, Abuja people.
Good morning, Joseph. Joseph, good morning.
Good morning.
How are you there?
Fine.
Yeah, Joseph, go ahead with your question, please.
Okay, my question is, we growing up, we are told that taking excess of all these sugary drinks and canned drinks can expose us to getting diabetes and consuming too much sugar and all this. So I want to know how true is this, and then can we stop taking all these things, or is it true, and what can we do to prevent this stuff?
Okay. Thank you very much. Thank you very much. That's a very that Joseph, your question is a little bit technical. That's a medical question on its own. Okay, so at the same time, it's a simple question. Now, the carbohydrates. For those of us that started the show with us, I did say at the beginning that those of us who can remember secondary school biology, carbohydrates gets broken down when we eat rice, yam. Mention them. All the sources of carbohydrate.
Bread.
Okay, so what the body uses what the body gets from that is called carbohydrate. But the body cannot make use of carbohydrate because it's a big molecule. It's a macro molecule. Okay, so it gets broken down to a smaller, tinier molecules that the body can use, and that is called glucose.
Stored as glycogen.
Exactly, in the muscles of the body. My doctor, you're doing wonderfully well. Okay, now, when you take that in excess, okay, your body system will have to make use of the ones it can make use of, and then the extra one that it cannot make use will be stored as glycogen. Now, in cases of where there may be starvation, you may be fasting, or you've not been able to eat for one reason or the other, the body system will go back at those ones that are stored and start breaking it down in a process that's called glycogenolysis. Okay, so it breaks it down and derives glucose again from there. Okay, so but eating plenty of carbs can actually increase your blood glucose level. Over time, you belabor your system in such a way that you begin to add weight. And of course, once weight gain sets in, possibility of developing diabetes is there. Okay. Sam from Plateau.
Good morning, Sam.
Good morning, sir.
Definitely you are calling from Jos. Good morning, Sam. Sam, are you there? You may have to try call us back.
So let's go back to the
Are you on the 23-year-old now, sir?
Now, the 23-year-old most likely has type 2 diabetes because she's not on insulin. If she was on insulin...
Sorry, doctor. We'll have to cut you a bit to go on this skinny break.
Let me quickly go back to some of the symptoms that our callers have, some of the questions that our callers have asked us to dwell on. Okay, top on the list is the symptoms of diabetes. Now, symptoms of diabetes, I mentioned earlier that frequent urination is a major symptom for diabetes. Okay, people who have diabetes can also have unexplained weakness. They could have blurring of vision. Okay, they could have fatigue. Okay, they could have occasionally tingling sensation of the hands and legs. Okay. Sam from Plateau.
Sam. Lucky you, Sam. Lucky you. Feels good to have you again.
Okay.
Yeah,
okay, go ahead.
Yeah, good morning.
Yeah, good morning once more.
Yeah. I have a question for the doctor.
Please go ahead.
You mentioned earlier that alcohol intake is bad for diabetic patients.
Harmful use of alcohol, sir. Harmful use of alcohol.
Okay.
Yes.
So does it mean all type of alcohol? Because we have alcohol in different. We have the spirit and. Hello.
I understand. I understand what you're saying.
Yeah. So we have the lager beer. We have the spirit, the gin. So
whiskey.
Any of it is recommended for a patient living with diabetes.
Thank you very much. Now, as a science student, if I can remember what I was taught in secondary school, I know that alcohol are depicted with the alphabet ROH, R/OH. Okay, so meaning that all alcohol are the same. Okay, but you may have them in different varieties. Alcohol can beer contains alcohol. Whiskey contains alcohol. Okay,
lager.
Gin contains alcohol. Palm wine contains alcohol. Okay, but the chemical compound is ROH/R/OH. Okay, so they are the same thing. Regardless of what medium that contains the alcohol, they are the same. What we are talking about is the harmful use of alcohol. Okay, so that can actually be red wine, we have been told, can be good for the heart. Okay, but when they are taken in moderation, it's a harmful use that is a problem. But for smoking, is a no-no. Okay, for smoking or use of tobacco or tobacco use, it should be a no-no for everybody. Thank you very much. Okay, so back to the symptoms. That
you were on unexplained weakness.
Unexplained weakness. Some people may also have weight loss. Some may eat more than they were used to. So it comes in a number of ways. Okay, so these are some of the signs that when you see, you need to go check your system. And the way to dictate diabetes is by doing very simple and inexpensive test. So that takes us to diagnosis. How is diabetes diagnosed or diagnosed in the hospital? The simple way to check who has diabetes and who does not have is to subject the person to just 2 simple tests. They're not limited to the ones I'm going to mention now, but those 2 will give you an idea. Number 1, the person can get to do a blood sugar test, which could be fasting blood sugar or random blood sugar. Fasting blood sugar, if the person hasn't had breakfast, usually done in the morning hours, okay? Random blood sugar, if the person has taken a meal in the day, okay? Now, if you do a blood sugar and if you do a fasting blood sugar and you have a reading that is beyond 100, there is a problem. That takes me to pre-diabetes. There's also pre-diabetes, in which case you have impaired glucose tolerance and impaired glycemic tolerance. Okay, so that may be pre-diabetes, quarter to diabetes if you like. Okay, but if you do and you have obvious derangement, the reading is far above 120 milligrams per day, it's likely that the person has gotten into diabetic range. Okay, that's for fasting blood sugar. If you do a random blood sugar and is not within the range of 60 to 180 milligrams per day, you should be worried, especially when it's getting 200 and above and everything. Another thing that can quickly be done to dictate if you're diabetic is to just do a simple test with your urinalysis. If you do a urinalysis and you get either 1+ or 2 pluses of sugar in your urine, it shows you are diabetic. What is going on is that your system is trying to force out the excess sugar in your blood through some other means. The body system must have tried to elevate the production of insulin to heighten the level of insulin that it produces. It's using some other unconventional means, trying to push out the excess sugar level from the body, and that is why you find glucose in the urine. That takes me to the story I wanted to tell. Yes, of our forefathers. Usually they will bring 3 people. If they suspect that any of them may have diabetes, and they will make 3 circles in 3 different places. They will ask A, Mr. A, please urinate on this circle. B, do the same thing on this circle. And of course, the 3rd person does the same thing on this. They will urinate on each of those circles and leave it for a while. They will return back after some period of time. If you find glucose in any of the circles, it means the person who urinated there have diabetes. And this was an incredible way with which... How
do you find glucose there? Ant?
Yes. When you have presence of ants hovering on a particular spot within the circle, it means that there's glucose that attracted the ants. There's sugar there. So it is abnormal for anybody to have sugar in his or her urine. If you have sugar in your urine, it's called glucosuria. That's another way of dictating who has diabetes. Also, you may also do what we refer to as HbA1c, glycated hemoglobin. This can actually give an idea of your sugar control in the last couple of months, say 2 to 3 months ago. So it gives you an idea. If it is high, it means you're diabetic. If it's within normal, you're good. Okay? So these are some of the measures that you can take to dictate if you have diabetes or not. The other additional things you need to do is to ensure that you do not have some other comorbidities. Comorbidities like hypertension. If you have hypertension already, you must ensure that you have good BP control. Ensure you take your drugs, follow your doctor's advice, follow science. Okay? You also need to know the levels, know your numbers, the levels of your blood lipids, cholesterol levels, and what have you. You need to also do a fasting lipid profile. That will give you the levels of the parameters that you have in that panel. Okay? Now, if your cholesterols are high, you need to start taking measures to bring it down. Sometimes it could be non-pharmaceutical interventions that may be needed to bring it down, in which case you need to stay physically active, do a lot more exercise. Every individual should do at least 30 minutes of increased physical activity or physical activity over a 24-hour period. You could be walking about in your place of work. Don't just wait until you get to the field or until you dress up to take a walk on your street or do an early morning jogging and all whatnot. You can do exercise wherever you find yourselves. Because if you keep planning to make it official, in quotes, by coming out with your trainers, sneakers, and jog on the road, take pictures and post on social media, you may not have that time.
Yeah.
That is the truth. So you need to ensure that you have increased activity that will help you. And that also will help the insulin to function better in the body. Okay? So these are some of the ways you can dictate who has diabetes and who does not have diabetes. There are other tests that may be necessary depending on what the findings are. But these are basic tests that do not cost plenty of money to have them done. Okay? In Nigeria, urinalysis and random blood sugar may not cost you more than 1,500 to 2,000 naira. So this is something everybody can afford. You may not even get to a hospital to have it done. You can go to a lab center or a diagnosis center and tell them you want to do this. So it's important we do checks. Those health checks will actually give us.
But Dr. Barth, let me quickly ask this question before we go. The question is, most times we talk about the excess of sugar in the body, all from carbohydrates leading to this diabetes problem. Is it that it's never possible to have excess of protein too in the body? Is protein never enough in the body that it can also cause damage? Is it that no human can attain that level of excess protein in the body? Because every time it is carbohydrate food leading to sugar and causing diabetes. We've never heard of the proteinous side.
Thank you very much. Whether there's any disease that is linked
from excess.
There are.
Or we don't get to consume enough protein.
Yeah, no. Not that we don't get to consume. There are some disease conditions that may be related to excessive protein intake in the body. But let me start from the known ones. Usually for people who have CKD, kidney problems, we usually advise them to reduce their intake of protein. Okay, because the protein that you take, the body will have to push them out in one way or the other. Okay, so if you take plenty of protein, your urea can go up. Okay, the creatinine too can go up, but this can only happen in people who already have a derangement in the system. People who have kidney problems, chronic kidney disease precisely. Okay, the other conditions that I may not bore you with, acromegaly and what have you. Okay, but it's unlike the picture we have in diabetes. Okay, so some of the things I have here on tips to control diabetes: regular exercise, we've talked about that; controlling carbohydrate intake, we have talked about that; keeping body weight under control, key, very key. You need to shed weight. If you are overweight, if you're obese, you need to shed weight, and that you can do in a number of ways. Okay. Increasing fiber intake, increasing eating, small, drinking enough water, adequate sleep, and a whole lot.
Okay, Dr. Barth, you have done justice.
This is the much our time can take us.
You've done
over to you, sir.
You've done a lovely job on diabetes and COVID-19. And if our viewers really enjoyed this episode, same time next week, 8:30 to 9:30, we'll go a day here again to give you nothing but the best on health tips on Top Health Matter. My name is never changed, I'm still Chief Olododo, and our host, Dr.
Barth Ufebunan. So we'll see you again next week together. Thank you. Stay safe. Stick to science.
Stick to science. That's the word.
Yes, sir.